Welcome to the Increda-dental podcast. I'm your host, Alicia Flynn. Our goal is to make a positive impact in the dental field. I have been a dental assistant, a biller, an office manager, a scheduler, a hygienist, and a dental coach, which makes me your biggest fan. My husband was in the military and we traveled all over the United States. I had opportunities to work in many different practices, and I saw incredible practices and practices that had a lot of potential within them. Thank you for joining us. Let's dive into the podcast. Welcome to the Increda-dental podcast. I'm your host, Alicia Flynn. Now, today we want to dive into a story. And the reason why I like to do stories or examples is because it takes our judgment out of that picture. Because sometimes if I just relate something, we can get really defensive. And I don't want you to be defensive. I want to see this as an opportunity to learn. So there's a practice that I was coaching. They have 3 locations. They were 10 dentists and a total of 13 hygienists. Now, the problem that they were having was that even within the same dental practice, so not one practice to another, but even within the same building, there were huge discrepancies that they were having with the hygiene department and even with the dentists too. So we wanted to see what was going on and how we could align together, because these were some of the examples that they were showing. They showed that one person was doing just a regular prophy when there's radiographic calculus, and another person was doing SRP in all quads when there were only 2 spots of 4 millimeter pockets in 2 separate quads. So what to do to get people aligned and on the same protocol, not so that we were exact with each other, where they ask exactly the same questions and we say exactly the same words, but where our diagnosis complements each other, where we diagnose and everyone's on board and there is a firm understanding. Because if we don't have that firm understanding, patients get confused. They don't understand why one person cleaned their teeth 6 months ago and now they need SRP, or why they weren't told that they have disease in their mouth. We want to avoid patient confusion as well as frustration and all be aligned together. So here are a couple techniques to help you with this. And this is one of the problems they had in this practice, is that they were only choosing 1 or 2 people, the hygienist, to go to continuing education with them. And when they got back from the continuing education, they weren't sharing the new knowledge with the rest of the staff of where they wanted to go. So really poor communication. So if you have certain members who are going to continuing education and you're funding it especially, you owe it to that department that they share what they learned. So that way they're aligned together. And I encourage you, this office, they didn't want to close all the practices. They wanted to instead rotate who is going to these continuing educations, which is fine. You can do that. But there was accountability where that hygienist cannot say that information and use it against the other hygienist, but they need to use it to share their knowledge, to build the relationship, to increase patient health, and to build the practice. So make sure you rotate who goes to continuing education if you're paying for it, and make sure it's clearly understood that they have to share the knowledge they learned, because there is responsibility in that. And then from there, after we recognized that problem, that was the first thing we recognized, but that one was a longer item to take care of. This is what we started to do. So we started to go over how to read in the X-ray radiographic calculus. We went over how to tell if there was decay, so that way they could prepare the patient for more treatment. We also went over probing depths and bleeding points and recognizing the difference between a prophy, a D0110, and cleaning in the presence of inflammation, a D4346. We also went over the information of what qualifies as disease and needing of SRP or debridement. Now, we didn't do this in a day, and I need to make sure you understand that. Don't sit down and define this all at one time. And don't do this in an isolated setting where the doctor or the office manager or one hygienist, if there's multiple hygienists, sit down and define everything. You need to have buy-in from everyone in your practice who this affects, who especially is diagnosing. Because when everyone's aligned together, you're going to get buy-in and you're going to be more successful. So we sat down and we talked about, what does a regular prophy look like? And if there's a place where there's isolated bleeding, what do we do? And we defined with the team
how we could change things, how we could help the patient understand what's going on in their mouth, how it affects their body, and what would be the best interest of the patient. From there, we went to the next item, the 4346, scaling the presence of inflammation. And we defined that. And then we talked about what is the follow-up, what's the protocol for a follow-up with a patient on a 4346 treatment. So we made sure everyone had the right protocol to follow, leading the patients to success, reducing confusion, increasing patient health. And as we did this, the profitability of the practice went up because confusion went down. Everyone was on the same page. They were aligned, and it was a successful opportunity to move forward in patient care. Because that's really our goal. Our goal is to help patients to be as healthy as possible and have the best experience when they're in our dental chair. Choose out what works best for you and start small. Remember, Rome wasn't built in a day, and it takes a while to get everyone on board, but take in information from everyone because you're going to be more successful when you do this. If you need help, please contact me at Increda-dental.com. We'll have a small chat, see what we can do to help you. But my biggest goal is to see you succeed. I don't want you to have the practice my dad did, where he was struggling, barely making ends meet, working until the age of 77, and truly not a wonderful practice, but a very high stress, very frustrating practice. I want you to have a beautiful practice where it's a dream. Things run smoothly. There are hiccups that come along the way, but for the most part, it's an amazing practice. Thanks for joining me.